Hi, good morning, everybody, or good afternoon or good evening, depending on where you are in the world. Thank you guys so much for joining me today. And I'm going to get right into it. I am going to start answering your questions. I want to thank each and every one of you for being here today, for supporting my channel. I appreciate all of you, and I hope that you are learning a lot. So we'll get started. The first question I see here is, Audie, how can I prevent kidney stones? And so how can you prevent kidney stones? Well, it really depends on, if you're getting a lot of kidney stones, the first thing you should do is definitely see a urologist to get a 24-hour urine test and some blood work to see why exactly you're forming kidney stones. And prevention, there's 5 big things that you can do. Drink lots and lots of fluid, so over 2.5 liters of fluid a day. You want to avoid high salt intake and high protein intake because that can actually put you at higher risk for kidney stones. You want to increase your fruit and vegetable intake, and sometimes Crystal Light can really help. If you like that and it's easily accessible to you, you can put it in your water, and that actually helps prevent kidney stones. And lastly, you still want to take a normal amount of calcium. So that's important. A lot of people think they have to limit their calcium, and actually that's not helpful. And lastly, you want to avoid high oxalate foods. And if you Google high oxalate foods, you're going to see lots and lots of different types of foods that have oxalate in them. But just see if there's anything you eat in abundance. So if you eat a lot of spinach, a lot of beets, a lot of nuts, then maybe cut back on those. But you can't really eliminate all the oxalate in your diet. It's quite challenging. So I hope that's helpful. Next question is from Mark. What medical procedure would be used to check for bacterial prostatitis? So bacterial prostatitis, first and foremost is treated by most often if people have acute bacterial prostatitis, you'll be very, very ill. And what that is, it's an infection of the prostate. And typically people will have fever, will have chills, will have pain, and will have pain with urination. So it's treated clinically. You don't want to actually examine a prostate when someone has a bacterial infection of the prostate, because that can actually cause what's called sepsis and cause the bacteria from the prostate to go throughout the body and make you very, very sick. In chronic bacterial prostatitis, there are certain techniques to test for bacteria in the prostatic secretions. And that is typically done by, one, we check the urine before you, when you're urinating normally. Then there are different kind of times you'll maybe get a prostatic massage and then check a urine after that to see and then urinate after that and check the urine to see if there's any secretions of bacteria in the urine collection. Next question is prostate massage healthy for you on a regular basis? So there's no data on prostate massage on a regular basis. Certainly, as I've mentioned in my video about prostate massage, it was used actually as a treatment for chronic non-bacterial prostatitis for some time. However, studies have shown that it's not useful. So really, to tell you the truth, there's no real good evidence if it's healthy or not, and if it's going to help you or not. Devinder says, having low urine pressure at night, is this a symptom of prostatic enlargement or urethral stricture? That's a great question. So I think what you mean by low urine pressure is having a weak urinary stream. And so people might feel like they're waking up at night and urinating and their stream is not very strong. And that can actually be a sign of both of those things. So typically a urethral stricture is a narrowing of the urethra. Very often it happens in people who've had some sort of trauma or have had a procedure before, like a cystoscopy or something for kidney stones. However, it can happen, you may not even notice. I have many patients who get urethral strictures who don't notice. However, it's much less common than having an enlarged prostate in men. So if you're older, over the age of 50, it's more likely that it's because you have an enlarged prostate, which can block the flow of urine. So if you want to check out my videos, I've made 2 videos one on enlarged prostate and one on a urethral stricture where I was reacting to Johnny Knoxville. I'll link all of these videos in the description after we're all done so that you can kind of find those videos. Next question, Dingerma, is there any hope of regaining the use of prostate and seminal vesicles after radiation therapy for prostate cancer? The cancer is gone. I'm hoping of some type of stem cell therapy. So specifically your prostatic function, your seminal vesicles is to make ejaculate. And unfortunately, after radiation therapy, which targets the prostate and seminal vesicles, which are the sac-like structures that sit behind the prostate, those are full of those are where semen and sperm are stored. And so when you have radiation, it causes damage to these tissues and fibrosis. And so it actually is very unlikely that those tissues will become healthy again. In fact, impossible. And so stem cell therapy is not something that's used for that issue. And so no, it's really not. Unfortunately, the answer is no. Next question is, are there any remedies for loss of male libido? Yes, absolutely. So libido is kind of a complex thing, but the first thing we do when we talk to men about libido is we check their testosterone levels, because very often a cause of low libido, a medical cause, is low testosterone. So that's one thing you'd want to get checked out. Also, if you're on certain medications like antidepressants, those can affect your libido as well. So making sure, one, there's no medical causes associated with the libido and treating those. And if you're interested to learn about testosterone therapy, you can check out, I've made a couple videos, but the most recent one is on testosterone replacement therapy, which you can, I'll link that down below as well. And then, having stress and anxiety and other mental health issues can also affect libido. So focusing on those. And then if you've tried all these things, there's nothing medically wrong with you, you've seen your doctor, you've tried to manage your stress, and seeing a sex therapist can be very helpful in this area. So next question I'm seeing, does testosterone replacement make you gain unhealthy weight? Thanks, Armando, for that question. So testosterone replacement is not correlated with weight gain, which is, it does help actually help you gain muscle mass more easily. So you might gain weight from gaining more muscle, but it's not weight from fat necessarily. Roel says, I'm a combat veteran. I'm asking, do injuries and depression affect libido? Absolutely. So just like I mentioned earlier, libido can absolutely be affected by depression and stress and prior injuries. How to last longer in bed, Kurumbukas. So this is a loaded question because I think that a lot of men feel this pressure to last for a very, very long time. But if you look at the average duration of sex, which I've made a video on that, it's about 5 minutes. So that's penetrative intercourse is about 5 minutes. And so if you're lasting longer than that, well, you're doing better than average. And so I feel like there's a lot of stress and anxiety about needing to last longer. And if you are lasting less than that, or it's causing distress to your relationship, then certainly there are ways and treatments available to treat what we call premature ejaculation. And those include using things like numbing agents on the penis before intercourse. There are delay sprays and creams that we can prescribe, and I'll link some down below. There is off-label treatments with antidepressants that you can use for premature ejaculation. And then lastly, there are techniques that you can do in the bed, like start and stop technique, or something that's kind of called edging, to try to help you last longer. But again, if you're lasting more than 5 minutes, I want you to realize that, there's nothing wrong with you. You're completely normal. And you may want to try other ways to pleasure your partner, because there's many other techniques available besides penetrative intercourse for that. So nocturnal emission happens 3 to 4 times every month. Is it normal? Absolutely. So if you don't ejaculate regularly, your body takes care of it for you. You will have emissions at night, and that's completely normal. What to do if tadalafil is not working, Travis? Travis, thank you for that. So tadalafil is a medication which is used for erectile dysfunction, which I made a video about recently. And if that is not working, one, you want to make sure you're taking it correctly, that you're taking it an hour before intercourse, and you're having some stimulation in order for it to work. Or if you're taking it daily, you can also take a low dose, 5 milligrams every single day, which sometimes works better than the on-demand medication. The highest dosing is 20 milligrams, which you can take on demand, and then daily you can take a 5 milligram dose. If that's not working, you can try other medications like sildenafil or vardenafil. And if those don't work, there are other options available. Those include using an intraurethral suppository, like a little pill that goes in the urethra. And there's also vacuum erection devices that can help. And then there's also injections that you can be taught to give yourself called intracavernosal injections. And while those sound super scary, they're really not. They are a very small needle. We teach you how to do it in the office, and it's really easy, and it actually works quite well. So there's a question about dry skin on the penis and low sensitivity. No, there is no reason to be concerned that moisturizing should decrease sensitivity. That's probably not the reason, but I would talk to your primary care doctor or neurologist to see if you have a neurologic issue that might be causing a change in sensitivity. Is pain in the testicles something to be extremely worried about? I wake up with pain, but it goes away during the day. So testicular pain is very multifactorial. A lot of the times it can be due to so there's a lot of different causes for it, so to speak. But I would see your primary care doctor, get an examine yourself, make sure there's no lumps and bumps or anything that might be concerning, and don't delay. If you see something abnormal, please go see a urologist to get examined, and then they can help you work on the pain issues if they persist, and how to get that better. But usually, speaking, if pain gets better, that's a good sign. Great question, Dan, about a vasectomy. So if you've had a vasectomy, if anyone's ever had a vasectomy, you should get a post-vasectomy semen analysis after about 2 months to see if the vasectomy has completely worked. Usually it does, but we can't confirm or deny that it's worked until you get a post-vasectomy semen analysis. And just as a disclaimer, all the advice and questions I'm answering, these are general medical education only. I am not your doctor. You cannot take my advice and avoid going to see your primary care doctor or your urologist. So please make sure that if you have a real concern that you see your doctor. Another question about medications for erectile dysfunction. What causes it to not work or not be as effective? Well, really depends on the degree of erectile dysfunction. The first and most obvious thing is that sometimes people don't use it correctly. They take it on a full stomach. They don't wait long enough. They don't have they want it to just work without any sort of stimulation. So make sure you're taking it correctly. And for some people, it's not effective. About 60% of people will be effective. 60 to 70% of people will have will have good erections with Viagra, and the others will not, and so they'll have to try other medications or other treatment options that we discussed earlier. Okay. This is a question about your bladder size. How much can an average bladder person hold in before having to take a leak? And how much does one urinate out on average? That's a great question. So the bladder on average holds about 10 to 20 ounces. So 16 ounces is probably an average amount. And so that's really, around 400 mLs if you're not in the United States and don't use ounces. So that's the average size, but it can be variable person to person. And so some people can hold 10 ounces, some people can hold 20 ounces, but that's kind of the range. If you find that you're holding much less than that, then please see a urologist to talk about options to maybe help increase that bladder size or work on things that can help you so you don't go to the bathroom so frequently. What are the risks of urethral sounding? So urethral sounding, I've made a video about this, is the practice of inserting an object into the urethra for pleasure. And so there are certainly risks associated with it. I don't recommend it, but if you are really adamant on doing it, then the way to do it is to use sounds that are actually made for urethral sounding. So the best thing would be to go on eBay or go online and find devices that are made exactly for the urethra. Even if you can get surgical urethral sounds that we use in surgery, those are made and shaped and designed for the urethra. You want to make sure you use sterile lubricant. Get either rip-off packets that make sure, because otherwise the lubricant can get bacteria on it if it touches other things or it remains open. So and make sure every time you use lubricant, it is completely sterile, and you never want to force anything into the urethra. But definitely check out my video where I talk a little bit more about this. How do you cure a urethral stricture? Great question, Dario. So a urethral stricture is a narrowing of the urethra, as I mentioned earlier, that is caused by, can be caused by trauma, can be caused by having a procedure before, or sometimes we don't know. You may have had an injury that you don't really remember. But curing urethral stricture is with surgery of some sort. So either a dilation of the urethra or a surgery, depending on the length of the stricture, to either cut the two ends of the urethra, remove the stricture and put them back together, or use other sorts of grafts like them from the inside of your mouth to fix the stricture. But again, need to see a urologist to get treated. It will not get better on its own. Okay. Good morning, Chris. How important is it to make sure your heart health is before taking ED treatment? If you've had a heart attack, So if you've had a heart attack or you have heart disease, you should talk to your cardiologist or primary care doctor before starting any medications for erectile dysfunction. Specifically, if you are taking nitrates, so nitroglycerin or a pill that goes underneath your tongue when you are taking for chest pain, you cannot take these medications at the same time because your blood pressure can drop really, really low to a dangerous level. And so you do need to talk to your cardiologist about it before taking those medications. And fortunately, there are other options. If you can't take those medications, as I mentioned earlier, there are other ways to treat erectile dysfunction, and those may be better for you. I have a question about phimosis. Phimosis is when the foreskin of the penis doesn't retract, and that can be caused by in children, we see it a lot, and it's normal up to the age of 7, but as adults, it's when the foreskin doesn't pull back, and it can be because of, inflammation, things like that. But essentially, what can you do about it? Well, you can try to do kind of steroid creams and gentle stretching of the penis, but that usually doesn't work. And very often it requires a circumcision. You can check my video about buried penis, and I will link it again down in the description. Okay. There's a question about a white deposit on your penis. Please see your urologist. I can't tell you over the internet what the answer to that is. So please make sure you see your urologist and get that evaluated. Parker, what is the best way to deal with an overactive bladder that affects me at night more so than during the day? You've taken tamsulosin and bladder Botox. So again, general medical education. I can't tell you exactly what you specifically need to do, but for overactive bladder, it sounds like they're treating you both for an enlarged prostate and an overactive bladder. So probably I would, if you were my patient, I would have you get urodynamics, a test to evaluate what's the bigger problem. Is it because your prostate is enlarged, or is it because your bladder is overactive on its own? And based on that, I would go down the treatment pathway for medications or procedures for an enlarged prostate or overactive bladder. If you want to learn more about enlarged prostate, check out my video on BPH, but briefly, there's medications that you've tried, Flomax, finasteride, or any sort of finasteride or any 5-alpha reductase inhibitor medication. And actually, interestingly, tadalafil in a low dose daily has been approved for enlarged prostate. If those don't work, then there are procedures and surgeries available for an enlarged prostate. So please talk to your physician about those. If you have truly, that's the problem. For overactive bladder, sounds like you may have tried some medications, but there's a whole host of medications available. There's anticholinergics and beta-3 agonists, and there's several medications available to try. And if those don't work, then we move on to third line therapies like Botox, sacral neuromodulation, which is a bladder pacemaker, and tibial nerve stimulation, which is basically like an acupuncture treatment. Again, I would strongly encourage you to talk to your doctor. If you're waking up a lot at night, make sure you're avoiding drinking 2 hours before bed and avoid bladder irritants. So I'm going to put a link to the video about bladder irritants in the description, but those include alcohol and caffeine particularly. And then for some people, artificial sweeteners, spicy foods, acidic foods, tomato-based products can irritate your bladder and maybe make you wake up a little more at night. Okay, so another question, treatment of Peyronie's disease. So the treatment of Peyronie's disease, I made an entire video on that as well, and I will link it in the description below. But essentially what the treatments offer are, is if it's not bothersome to you, it's not dangerous. So nothing to do in that case. But if it is bothersome to you, or you're having difficulty having intercourse or trying to get pregnant, then treatment options include using a penile traction device, injectable treatment into the penile plaque, or surgical options. Question from El Senor, what are your thoughts about pneuma surgery? And thank you for the super chat. Pneuma is a procedure that is cosmetic to increase the girth and length of the surgery. I made a video about it. There is some limited short-term data that has been released on the pneuma implant. I've never done it, so I can't really tell you what I think about it as far as my personal experience with it. I think that if you are considering it, make sure you know definitely the benefits and risks of a surgery like that. It's a big surgery anytime you're getting an implant in your penis, because it's there isn't a risk of infection. So I would take it very seriously and take some real consideration before you go through any cosmetic procedure. Next question is, what does a prostate biopsy involve? So a prostate biopsy is a procedure that is done to rule out prostate cancer. And what that involves is you get basically for the procedure, you will lie on your side and a probe, or on your back with your legs in the air, depending on how your doctor does it. And a probe will be placed into the rectum or the bottom. And that helps us identify where the prostate is. And then through there, you get it numbed with medication first, so you feel a pinch and a burn, and then afterwards you feel you get about 12 biopsies of the prostate itself. So there's little pokes in the prostate. You shouldn't feel them because you're numb, but it takes about maybe 5 to 10 minutes, the whole process, and then you're all done. I think really a lot of anxiety around it is, normal, but trying to kind of be relaxed for the procedure. You can even ask maybe your physician to give you an anti-anxiety medication before if you're really nervous, but make sure you have a driver if you do that. There are also newer techniques that are transperineal, that are through the area underneath the scrotum instead of going through the bottom, but with the biopsy, but you still need to visualize the prostate with the probe in the rectum. And there are also MRI guided prostate biopsies, which are that have been shown to be more effective in identifying clinically significant cancers. So if your doctor offers that, that would be great. Okay, so Elu, your question about ejaculating too soon, that's defined as premature ejaculation. I've already talked about it a little bit earlier, so you can rewind back to find it. And I will also link a video where I talked about it briefly in a reaction to Sex in the City down below once we're done with we're done with this chat. So I've noticed an occasional tingling in the male urethra 1 to 2 days after intercourse. Is this a sign of infection or UTI? Well, I can't tell you that. So you'd have to go see your doctor, get a urine test to see if there's any signs of urinary tract infection, and get treated if it is. If not, then you'll have to get an exam to see if there's anything else going on, and maybe even a cystoscopy to assess. But I would say the first thing would be to start drinking a lot more fluid and make sure that you're really well hydrated, because that's usually, if anything is concentrated, it can cause some tingling sensation. Burning ejaculation in the same vein could be a sign of a urinary tract infection. Please go see your doctor to get evaluated. Make sure you drink lots and lots of fluids to try and hydrate yourself and see if that helps. All right. Well, I hope this was helpful to you guys. Thank you so much for joining me today. It's been a great day, and I'm so glad to have helped you all. And there's just so many questions coming in, so I'm sorry if I didn't get to all of you. And always remember to take care of yourself, because you're worth it.